Hi, so I'm Nina, and for my 486 project, I did polycystic ovarian syndrome, which abbreviated is PCOS for short. So what is PCOS? It is the overproduction of the male sex hormones, which are called androgens. That is also called hypoandrogism, which is just the overproduction of the male sex hormones. PCOS is usually marked by the increased amounts of testosterone. It also affects women who are in their childbearing years, which is puberty to menopause. The age ranges from 12 to 51, but it's different for every woman. So another thing of PCOS is that it involves follicles or cysts on the ovaries. So over here at this picture, there is the normal ovary, which has a couple cysts, which is normal, and follicles. And then over on the other side is a polycystic ovary, which polycystic stands for many cysts, just all around the ovary. PCOS can result in infertility, menstrual issues, and it affects a couple other body systems. So the ovaries are the main organ affected, and due to the cysts and follicles that surround the ovaries, they do not ovulate. So there's a difference between cysts and follicles. It's a little bit difficult to tell the difference between the two, especially on an ultrasound, but a follicle contains an egg while a cyst does not. And then there is a hormone imbalance involved in PCOS, which inhibits the follicle from releasing the egg. So there is that hormone imbalance between the female sex hormones and the male sex hormones. The female hormones are estrogen, which regulates the menstrual cycle and the reproductive system, progesterone, which prepares a woman's body for a pregnancy by thickening the uterine lining, FSH, which is follicle stimulating hormone, and that stimulates the ovaries to produce a follicle, and LH, which is luteinizing hormone, which causes the ovaries to release an egg. And we're going to talk about that more later. So some symptoms of PCOS are an irregular menstrual cycle, so that's missed or a few periods, too frequent periods, or just non-existent. Infertility, hirsutism, which is excessive hair growth, and that's on the face, chin, or neck. Acne and oily skin, also on the face, on the chin, and on the upper back. Thinning hair, weight gain, or difficulty losing weight. Darkening of skin along neck creases, the groin, and under the breast, and then skin tags, which are small and excessive flaps of skin in the armpit and the neck area. The prevalence of PCOS is that 5 to 15% of women are diagnosed with PCOS, and about 70% of women do not even know they have it. And that also plays a huge part in the symptoms that women experience from PCOS. Just because the severity is so different, they can go almost their whole lives not even knowing that they have it. So 30% of women with PCOS have normal menses, which means like a normal period, no issues with it. More than 80% of women with PCOS have hypoandrogenism, which is the overproduction of the male sex hormones. 90% of women with polycystic ovaries also have hirsutism, which is the excessive hair growth. And then 15 to 30% of women with PCOS also have acne. So the causes of PCOS is kind of unknown. It's not like there's just one cause. High levels of the androgens prevent the ovaries from functioning properly, which is hypoandrogenism. Genes, insulin resistant, and inflammation have been possible causes for it. So PCOS runs in families. So if a mom has it, it's highly likely that the daughter will have it too. And then with insulin resistance, the cells in the body aren't properly using insulin, which causes overproduction of insulin, which is then insulin resistance, which is also a cause of PCOS. So the pathophysiology of PCOS is that chronically elevated luteinizing hormone, LH, which is what we talked about earlier, and insulin resistance are the most common endocrine anomalies seen in PCOS. So luteinizing hormone is the hormone that releases the egg from the ovary, but if there's too much of it, it will increase the production of testosterone, which is the male sex hormone. Hyperinsulinemia and high LH, luteinizing hormone, cause ovarian growth, androgen production, and ovarian cyst formation, which is just a combination of those three, is PCOS. Obesity is very prevalent in PCOS patients, which can cause insulin resistance, but also non-obese patients can have insulin resistance too. So to diagnose PCOS, there's not one specific test. It's not like you go into your doctor and you're like, give me the test that tells me if I have PCOS or not. You most likely your doctor will have you answer questions about your medical history, your menstrual periods, and if there's any weight changes. They will also look for hair growth, acne, and any signs of insulin resistance. Then after that, just physical exam, they will move on to a pelvic exam, which is up at the top here. So it's just looking visually and manually at the reproductive organs for any masses or growths or any abnormalities, and then blood tests. So the hormone levels will be measured, especially the androgen levels, and then an ultrasound. And that looks at the ovaries for cysts and follicles and a possible thickness of the uterine lining. So if you do go to the doctors and you are positively diagnosed with PCOS, your blood pressure, glucose tolerance, cholesterol, and triglyceride levels should definitely be tested, and a depression and anxiety screening would be necessary, and then a sleep apnea test would be necessary too. So for the ultrasound, it is transvaginal, so the transducer sends sound waves to the ovaries to take pictures of them, just to look for any cyst. So on the right, you'll see an ultrasound of a normal ovary. It has a couple cysts, which is normal. And then down at the bottom, you can see the string of pearls, which refers to the ovaries being surrounded with cyst. So to diagnose PCOS, for a positive diagnosis, you must have two of these three, which are high androgen levels, irregular periods, and then cysts on the ovaries. To treat PCOS, there's not really like a pill you can take that's a cure-all, because basically women will have PCOS for their whole lives. Once she gets into menopause, her menstrual cycle will become more regular, but the hormone imbalance will always be there. Just due to the severity of symptoms, treatment is different for each woman. Lifestyles changes and medication are usually the best forms of treatment. So lifestyle change would be weight loss with physical activity and a diet, low carb diet preferably, and then a medication, which would be birth control. And there's the pill, the patch, the ring, the IUD, and all of these help regulate a woman's period and lessen the symptoms of PCOS. So with women getting pregnant and having PCOS, it is much difficult just because the ovaries are not ovulating due to all of the cysts preventing the eggs from leaving the ovaries. So 70% to 80% of women with PCOS experience difficulties getting pregnant. Women with PCOS are twice as likely to deliver a baby prematurely. They also have a higher risk of miscarriages and gestational diabetes. And then fertility treatments and weight loss can help improve ovulation. So most women who have PCOS and are unable to get pregnant, they do resort to fertility treatments. And then if those don't work, they can move on to in vitro fertilization. So there is a handful of health risks that come with PCOS. So PCOS and insulin resistance go hand in hand. About 70% of women who have PCOS are also insulin resistant. So insulin resistance is when the cells in the body cannot use insulin properly to convert sugar into energy. So the demand for insulin is increased, causing the pancreas to produce more, which the extra insulin triggers the ovaries to produce more of those male hormones, which is what the whole PCOS is. So metabolic syndrome is way more common in women with PCOS. Obesity is very common too. 80% of women with PCOS are overweight or obese. There's an increased risk of high blood sugar, high blood pressure, low HDL, and high LDL. And all of these are increase the risk of stroke, heart disease, and diabetes. Also, depression and anxiety are very common among women with PCOS. So exercise effects. So we're all taught that exercise is medicine, and it really is here for women with PCOS because it really helps to lessen their symptoms. So it'll help to regulate their menstrual cycle, can help increase fertility, lower blood pressure, decrease the effects of insulin resistance, prevent prediabetes and type 2 diabetes, as well as metabolic syndrome, and decrease inflammation. Definitely not like a cure-all, but it will help lessen the symptoms, make the side effects not as heavy. And then women who are overweight and obese with PCOS usually gain the most benefits from exercise. So, case study. Sally is a 27-year-old female who was diagnosed with PCOS when she was 17 years old through blood tests and ultrasounds. Sally is 66 inches tall. She weighs 165 pounds. Her resting blood pressure is 125/80. Her cholesterol is 208. Triglycerides are 158. HDL is 44. And LDL is 132. Her and her boyfriend are interested in starting a family together, but because of her PCOS, they've been having struggles. The doctor is recommending to make lifestyle changes to increase her odds of getting pregnant. He said to start a low-carb diet and to incorporate regular exercise into her daily routine. Sally works a busy job, and by the time she gets home from work, the last thing she wants to do is exercise. She participated in the Bruce Protocol treadmill test. She stopped after 8 minutes, and her heart rate was 190 beats per minute. So her exercise prescription for aerobic activity, it's best for 4 to 5 days a week. She does have a busy job, so whether that's before work or after work, she can definitely fit it in somewhere. She should start out at a moderate intensity at about 40 to 59% of her VO2, and then progress to vigorous intensity, which is about 60%. So she should start out with 30 to 40 minutes per session, which is the minimum of 150 minutes per week. And then if she really enjoys her exercise routine, feels if she's getting a lot out of it physically and mentally, she can definitely increase to about 60 minutes per day. She should stick to walking, cycling, jogging, and swimming. And then for resistance training, she should incorporate that 2 to 3 days per week, 60 to 70% of her 1RM. And then if she really wants to get stronger, she can definitely increase that as she goes along. 2 to 4 sets of 12, 2 to 4 sets of 8 to 12 reps for each major muscle group. So arms, legs, chest, back, abdomen, all of that. Resistance machines or free weights. And as she does get stronger, she can definitely increase her weight. If she is doing any over the head lifting, she should definitely have a spotter. And she definitely, if she's injured, she should not be lifting. So for flexibility, she should incorporate that 2 to 3 days per week. Stretch to tightness or slight discomfort. Hold stretch for 10 to 30 seconds, 2 to 4 reps of each stretch. Static, dynamic, and or PNF stretching. So just to refer back, she had a high cholesterol. Wasn't too high, but definitely was up there. Triglycerides were high. HDL could be better, but definitely not bad. And her LDLs were high too. So with this exercise prescription, all of those should decrease. Well, the cholesterol, triglycerides, and LDL will decrease, and then her HDL will increase and get to even a better range. And thank you.